Evidence from surveys and studies so far has shown that coronaviruses most highly related to SARS-CoV-2 are to be found in bats and pangolins. This suggests these mammals may be the reservoir of the virus that causes COVID-19 in humans, based on the high similarity between the genetic sequences of the sampled viruses and SARS-CoV-2. However, the viruses identified so far in bats and pangolins are not sufficiently similar to SARS-CoV-2 to serve as the direct source of SARS-CoV-2.
That's a clip from a joint news conference which has happened in Wuhan in the past couple of hours. TRT World's health correspondent Nicola Hill in London was listening to it. Nicola, the consensus seems to be that we haven't actually discovered anything critically important yet.
I think that's completely right, Adnan. In fact, they sort of said that they had two aims. They wanted to find out what had happened in Wuhan in the beginning of December, and they wanted to find out what caused the virus going to humans. The main thing they found out about Wuhan is that it wasn't around before the middle of December. They can categorically say that, but they can't say what's caused the virus jumping to humans. They had four hypotheses. The first one is that it was what they call a zoonotic spillover, basically just jumping straight from the bat straight to humans. And as Wuhan's nowhere near any bat colonies, they don't think that's the case, but they're still going to investigate. They still want to have a look at the potential of the virus in bats in other parts of China. The second hypothesis is that it went from bats to another animal and from that animal to humans. That's what they're leaning towards. They think that may well be the case, but they want more research because they're not sure exactly which animal that could have been. The third option, or the third hypothesis, is to do with the cold chain. Now, this market not only sold wet animals, it also sold products from other parts of China, other parts of the world, particularly frozen foods. And we know the virus does very well in the cold. So they're also investigating the suppliers, the traders, the farms. They started looking back at where these products came from, but obviously they need to do much more about that. So that's a possibility. And the fourth hypothesis was whether it was a leak from a lab in Wuhan. That's the only one that they're saying they're ruling out. They say that the virus, SARS-CoV-2 virus, wasn't in any labs in Wuhan, so it can't have leaked. And the conspiracy theory that it was developed, it was man-made, has been discredited by scientists worldwide. So they're definitely saying that's not the one. So they're leaning to bat to animal to human, but they don't know which one it is. Or potentially it was spread via cold chain by products that were also being sold in the market. But as you said, really, they don't know. There's years of research to continue.
Yeah, absolutely. As the WHO team has been saying, it could be years. OK, later in this programme, we're going to be talking about a country whose government doesn't believe in vaccinations against COVID-19. But the UK definitely doesn't fall in that camp and has been doing particularly well in its vaccination programme. How's it going?
Yeah, it is. The target they set was to have vaccinated nearly 15 million people by February the 15th, the top four groups of people based on age and underlying health conditions. They're at 12.8 million at the moment. They say that on Saturday, for example, they were doing 1,000 jabs a minute, which is incredible. Pop-up clinics all over the country, including in Moss, to try and encourage from the BAME communities, who unfortunately seem to be the community that is most resistant, most hesitant to being vaccinated. So that's great that they definitely seem to be on target. But out of that 12.8 million, only 500,000 are people who've had the second dose because of the policy here in the UK to increase the gap. Instead of 3 or 4 weeks between the two doses, they should be 12 weeks. And people are concerned. They don't know when they're going to get there. Some people don't know when they're going to get their second dose.